So Stephanie, about a year ago,
Yeah, just about 18 months ago, our carrier came to us as they gave us our informatics report. And they basically looked at me and they said, your ER usage is out of whack. And they said, we're not going to tell you how bad out of whack, but it's out of whack. And we don't think that your associates know what they're doing. And most of the reasons, 70% of our claims in the ER were for colds, the flu, a backache, and an earache. And when you really looked at the dollars, there were things that could be done in either a primary care physician's service or in a walk-in center or some type of urgent care facility. So basically, we knew that they didn't have the education to even look at that. On top of that, a little layer above it was the fact that they weren't using the preventative physical. And keep in mind, we put in the preventative physical prior to the mandate. So they were leaving their dollars on the table. So basically, we said, how are we going to get them to move this problem or move their idea of where they should be going for these services without educating them? So I basically sometimes nickname this ER 101. But what we didn't focus on was the dollars. We focused on their lack of prevention, their families, how important they were to us, the Market Basket family. So we basically talked to them a little bit about what they were doing well and a little bit about what they were not doing at all. We explained to them something simple as, okay, an emergency room costs average $1,000. This is your co-payment. And people would look at me like, what are you talking about? Like they thought I was crazy. If you go to the Pentucket walk-in, or if you go to the Lowell General walk-in, or if you go to the Saints walk-in, it costs this much. And when they started thinking about it, they started realizing my co-payment would be less. It'd be $40 versus $200. So we started talking to them about that. We talked to them about our nurse hotline. When I started, 3 people had called in a year. We got that up to over 150 in 6 months. We gave them tools to utilize when they go to a primary care physician. And then I started what I called the Dear Associate campaign letter. So I started writing to them. So first they heard me talk, then they started getting my mailings. And it was Dear Associate. And I would grab things like the Mass in Motion website. I would grab the pyramid, the food pyramid. I would send them Know Your Numbers cards. I sent them all magnets for the refrigerators on our Express Scripts program. And then we also partnered with our carrier because I realized there was a huge multicultural difference. A portion of our people went to the ER because that's all they knew from where they came from. So we had to get them comfortable. So we went to Blue Cross and we said, okay, you're giving it to us in English, but now we want it in Spanish. And they basically formatted for me something that one side was English, one side was Spanish, and we sent it to every single address. So in 1 year, we have moved, Sandy will tell you. We brought down our ER costs for those services that were not ER related about 18%, and we've upped the urgent care to about 10%. And unfortunately, I don't go shopping very much, because when I walk into a store, they say to me, oh, she's here. Like, okay, I took the phone call from Blue Cross. Yes, I did go for my colonoscopy. And you are making sense. And yes, I am going for my physical. So we're seeing the physicals going up. And this year, year 2, I went on the road again, and we basically targeted areas where we looked like they were getting it, but they weren't really getting it. And we're giving them, again, some of the same tools that we used the first time. So I always say to Sandy, it's the drip drip factor. They get that Dear Associate letter and they're like, oh, here she goes again. What's she writing to me about this time? But I've also reached out to them and said, what do you want to hear? What do you want to see? And we have gotten some feedback. I mean, diabetics. I've had Blue Cross write me newsletters just on diabetes. We've been some of the pilots for some of the text stuff that's on the Blue Cross website. We're looking at their transparency tool right now, because that's going to be a huge education process for my environment. And the other thing, to sum it up, I can best say is, you really have to find out who the people you are that you're servicing. Because if you don't come down to their level or you don't come down to their needs or how busy their lives are, you're not going to reach them.